Good morning, Mr. Gopalakrishnan.
Hi, Akansha. I can see Mark. I can see Andrew. I can see Kamal. I can see Avinash. Has Nisha joined?
Nisha just called in. She would be
Dr.
joining
Gopal,
in
give
about
me 2 minutes. I'll be
10
right back
to
with
15
you.
minutes.
Okay, she's also joining, right?
She would be joining it, but yeah, she's slightly delayed. So she said, if we can, start in case she's delayed, then we can start with, not put her, at the bottom of the speakers, and we can start with the other ones.
Okay. I think anyway, we have 10 more minutes actually before our session starts. 12 more minutes actually, to be precise. Yeah. Hi, Mark. How are you? I don't think I've met you before.
Good morning. How are you?
Morning to you, but
morning to me. Good afternoon. Good evening.
Yeah, it's good evening.
Good day.
Good. Here it's around 5:15 now, 5:20.
Wonderful. Well, it's a pleasure to be here, and I look forward to the discussion.
It hopefully will be very interesting. And how is the conference generally going, Akansha? How is it going?
Sorry?
How is the conference overall?
It's gone very well, Chairman.
Okay. And Andrew, how are you? Andrew is signed on. How are you, Avinash? Are you joining from India?
Yes, Mr. Gopalakrishnan, I'm joining from India.
Okay.
Pleasure to meet you all. Hi.
Yes, nice to meet you, and thank you for joining us actually.
Absolute pleasure.
And Kamal stepped away. I don't know whether he has come back or not.
No, he said he will be just back in 5-10 minutes.
Right.
Andrew is also here.
Yeah. Hi, Andrew. Thank you for joining.
Hi, nice to see you.
Nice to see you too. You're also based in US, I'm assuming.
I am, yes, in Ann Arbor, Michigan.
Ann Arbor, Michigan. That's nice.
Hi, Mark. How you doing?
Hey, Andrew. Good to see you.
Nice to see you.
we pop up at the most interesting places.
I know.
Hi, Kamal. How are you?
I'm fine, thank you. Good to be here in this panel. I will change my lighting in just a couple of minutes.
Yeah, if you can make sure the lighting is on.
Yes, you will have the perfect lighting.
Okay.
Just 1 minute.
Okay. No, we will have a good discussion. So hopefully it'll be interesting to the audience. And of course, this is a topic of interest to everyone. So,
how would you like the order to go on everything and kind of initial focus? Should we go over that really quick?
Yeah. So I will make some opening remarks. I will not make it very long, probably 2-3 minutes, and I will start with a question to each one, the same question, which is, we have had a global disaster. We are going through a global disaster right now. So what has worked well and what has not worked very well? What are the lessons that we can learn? And our focus is Indo-Pacific Alliance. So specifically in the Indo-Pacific region, how has this played out? So, if you can keep your remarks to between 3 to 5 minutes. Then the second, question I plan to ask in the next round is, clearly, this is not going to be the last one. right? And even as we speak, we are facing cyber attacks or cyber crimes. We have a slow burning issue of sustainability. So in the Indo-Pacific region, which is one of the most diverse regions, what are the disasters that could hurt us, in your opinion, over the next 10 years, so that we can start planning? And the third question is about, what are the solutions, one or two solutions that you can think of uh, from a response perspective at the national level or at the regional level or even at the global level. Do we have the institutions? Do we have the organizations? Are they effective? So that's, getting into solutioning mode. And then if you have time, and each of these things, if you can keep it to maybe about 3-4 minutes, we will have enough time. And then, I want to then get into, you know, bilateral, multilateral, regional, which are the best structures suited. And then, if you can give examples of, some of your own work. I would like to bring that into the discussion as early as possible. And you can even talk about this when you answer the first 3 questions. Then we will see how it goes. So that's the flow.
Perfect. That's really helpful. Thank you.
Good evening, Mr. Gopal Krishnan.
Hi, Renuka. How are you?
I'm good, sir. How are you? We'll start as soon as we have everybody join. I'm just waiting for a signal.
We have about 5 more minutes.
Yes, please. Yes, please.
So we are waiting for Nisha Desai
yes.
to join us.
She's just joining in a while.
And the order I was proposing was to start with, since Nisha is not joined, I'll start with Kamal, come to Mark, then Andrew and Avinash.
Sure.
And then I'll go to Nisha.
Sure. This is our last and final session, so it is an important one. Everybody is gathered around.
Thank you.
So, looking forward to it.
One challenge in the virtual world is that we don't know how many people are there in the audience.
I know, we can only just give you numbers all the time. I know when people ask, that's what happens. And somewhere in the middle.
Approximately how many people are supposed to be there on audience?
Today, being the last session, it's about 800.
Oh,
but otherwise, throughout the thing, we've had over 2,500 people attend.
Right.
It's been a great session last 3 days.
Very
great
nice.
Summit that way. Yes.
Very nice. So at 5:30, Renuka, we can get started. And
absolutely,
as Nisha
I
comes,
will invite
I will, I will add her to the back end of.
Sure. Who's following? I understand Nisha Biswal will join after 15 minutes. So with your permission, sir, may I start the session?
Oh, we are ready to start?
Yes.
Okay.
Good evening, ladies and gentlemen, and a very warm welcome to the last and final session of the Indo-Pacific Business Summit, organized by the Economic Diplomacy Division of the Ministry of External Affairs and the Confederation of Indian Industry. Building an Indo-Pacific alliance to mitigate disaster risks. As the session chair, may I request Mr. Chris Gopalakrishnan, past President CII and Chairman CII Digital Council and Task Force on Science and Data, co-founder Infosys Limited and Chairman Axeler Ventures Private Limited, to welcome everybody, set the context, which I think you already have done, sir, and take the session forward. Over to you, sir.
Thank you, Renuka, and a warm welcome to all my panelists. I'm looking forward to a very interesting discussion. And thank you to the organizers on behalf of all the panelists for having us here today. Good morning to all the participants from the US. Good evening to all the participants from India, Asia. This is, as Renuka said, this is the final session of the 3-day Indo-Pacific Business Summit. This region today houses about 60% of the world's population, and in that sense, a very, very important region of the world. We are in the midst of very challenging times as the world continues to reckon with the coronavirus pandemic and the impending challenges from a health perspective, from an economy perspective. The governments across the world are trying to strike the right balance between lives and livelihoods in solving the immediate needs, as well as focus on the long-term strategies towards mitigating the current crisis. The last 1.5 years has demonstrated how we can come together and work to the benefit of everyone. And it has also shown us some of the issues and the challenges. What I mean by this is the best of global cooperation is the vaccine itself. Within a very short period, within a couple of months, in February, truly the world came to realize that this is a pandemic. But by April, May, we had the first candidates for vaccines, and within a short period of 15 months, more than 1 billion people have been vaccinated already. So we have seen the best of global cooperation. We have also seen the issues that are emerging out of this. And again, when I come to the distribution of the vaccines, the amount of people, the number of people that have been vaccinated, you see disparities and you see challenges. So that itself, shows the strengths in the global alliance, and it is also showing us the weaknesses in the global alliances. So in this session, we want to explore, in the context of this pandemic, but then extend it to, future challenges, and we will come to that, that we could face. As I said, this is a most important region. This region today, accounts for about 50% of the GDP growth in the world today. So in that sense, it's a very, very important region of the world. We have a very, very eminent set of panelists who are here with us to discuss this. I will introduce them briefly, very short introduction. When I request them to speak, I will request now Mr. Kamal Kishore, who is a member of the National Disaster Management Authority, to go first. And here My question to you, Kamal, and to all the panelists on the first round is, as I said, we are going through a pandemic. We have some experience now over the last 15 years. And what, in your view, are the lessons that we can learn from the current pandemic that we can take forward into the future? So, Kamal, your views, please. And Kamal is part of the National Disaster Management Authority of India.
Thank you very much, and thank you to CII for inviting me to this very interesting discussion. We are still in the middle of the pandemic, but there are lessons already learned that we can begin to talk about, but it isn't over yet. And we still have to continue to grapple with uncertainties, unknowns, and so on. So I would like to highlight 3 principal lessons from a disaster risk management perspective. The first lesson is that in the 21st century, we cannot look at any disaster risk in isolation, which is combined to a particular set of people or a particular set of assets. I think the notion of systemic risk has really come of age. It's the time to really begin to talk about systems when we talk about risk, as opposed to specific locations and assets and communities only. We've seen how quickly risks can ripple across the entire global system. And this places unique challenges because the kind of risk modeling that we do, it is often confined to specific hazards and specific geographies. So we are very good at looking at risk emanating from specific hazards, but how they connect with each other, how they come together to produce the quote unquote perfect storm. I think that is something we have to become better at. What is the role of good data management, risk platforms? What are the limits to modeling? What are the ways to visualize future risk? I think that's we've all been challenged by the pandemic. So the first lesson is move toward systemic risk as opposed to looking at asset level risk. The second is our ability to repurpose resources and capacities from across multiple sectors will determine how we will deal with major hazard events of the future. This is very clear in the pandemic. Wherever we had to rise to the occasion, we couldn't just rely on health sector resources. We had to get resources from industry, from defense, from even agriculture and so on to basically scale the response. So scalability and repurposing is very important. The third lesson is how do we begin to evolve a new paradigm of disaster risk management, where people working on different kinds of risks, people who work on risks emanating from hazards such as earthquakes and cyclones and floods, as well as people working on chemical risk emanating from chemicals, risks emanating from biohazards. How do they begin to talk about a common risk language? All of us who work on risk management have been challenged in the current context as to how sometimes it has been difficult to work across disciplinary boundaries to look at risk in a comprehensive, coherent, and cohesive manner. So a common risk language across multiple risk management disciplines is another lesson that we have learned from the pandemic, which we need to build on going forward. Thank you very much, Gopal. I look forward to sort of engaging in this discussion just to kick off these 3 principal lessons.
Thank you, Kamal. Very interesting perspectives. But you've also highlighted that it's just not across the region, but within a country itself, we have challenges in terms of language, looking at it as a scalability issue, collaboration issue, data, very important, etc. So now let me ask the same question to Dr. Andrew Schroeder, Vice President of Research and Analysis, Direct Relief. Andrew, please.
Thank you very much, and thanks for inviting me. It's an honor to be with all of you. I would wholeheartedly agree with the three principles that Kamal outlined just a minute ago. To add a little bit to that, and my perspective is from a nonprofit organization, principally working in the health sector. We, have seen throughout the pandemic that when we are facing exponential threats, threats that don't sort of just build slowly over time, but can turn into rapidly multiplying threats, there's a principle of early detection, early action that becomes incredibly important. This was true in the events in India just recently, where you saw gradual case increase at the end of February, early March, that turned into an exponential runaway growth within a matter of days to weeks. And that's very hard to stem unless you begin your response well before you actually see the sort of exponential growth curve happen. This has happened everywhere across the world that we've through the pandemic, and it has echoes in climate change as well. And I think this is something that we've seen since the beginning of the pandemic, that this model around acting before you see the really visible runaway characteristics of the crisis is incredibly important. Climate change is obviously, and to build on the systems point, is an integrated systems crisis. But we see this having effects on the built environment, on the capacity of communities to respond to increased temperature. It has effects on the location of urban areas, the protection of those against coastal storm surge. It has impacts on agricultural production, on the ability of systems to be able to continue producing even under increasing threat from a variety of different sources. So I think this becomes actually quite important. I think the second kind of key point that to underscore is that collaboration, particularly international collaboration, has never been more important. One of the things that's been very challenging across the course of the pandemic globally has been the degree to which you've seen a number of different actors retreat into national responses and to kind of emphasize a sort of nation first kind of program, and we could cite many instances of this. This I think is exactly the opposite of what's needed in the face of exponential threats. It's no one has enough capacity to respond to these kinds of situations on their own, and particularly as you reach the peak of where these threats are occurring. We worked extensively with actors across India to deliver oxygen concentration to meet the recent needs in India. It was really clear that a whole range of Indian actors were essential, but international collaboration and effective support for Indian-driven initiatives was essential. This is not an either-or situation. We can approach international collaboration with the spirit of humility and support, but it's absolutely essential. And the third, I think, is really an emphasis on building up the systems that already exist. And I would again cite the recent events in the COVID response. I mean, as you've seen case counts and death counts and hospitalizations rise throughout the countryside, you see once again the essential role of primary healthcare, for instance. Rural healthcare is absolutely essential, but is consistently under-resourced, particularly in the public sector. And so, this is something we see throughout the world, including in the United States, that kind of these basic systems that provide day-to-day care become even more important during crisis. And the more that you're ready to support them beforehand, the more that they actually have effective resources. They're the sources of community trust. They're the places of first response, and we need those systems to be really effective. Not only to build a healthy population under normal circumstances, but even more so under crisis. And so we need to really pay more attention to those kind of core community-based systems. So I would add those 3 points to the excellent points that were made by Kamal earlier.
Thank you, Andrew. I would actually, summarize your points by saying, you highlighted the need for collaboration so that we can bring in swing capacity from outside the country, because no country can plan for exponential risk, because that is really, really expensive, and the system won't have the capacity. So you need to, move resources, and cooperation, collaboration is very much important. We saw that during the early stage of the crisis, where India was able to give some medicines and things like that. And then during the second wave in India, countries from around the world, from US, from Europe, from Singapore, Japan, all pitched in to support India. So that's a very, very important point about international collaboration and building or scaling up the systems that exist, again with help from outside as and when it's needed. Thank you, Andrew. Now let me come to Mark Lenhart. Mark is the Chief Philanthropy Officer, Society of Critical Care Medicine. Mark, please.
Thank you so much. It's an honor to join you today, and excited to participate. Just to echo some of the great comments that have already come before me, but I think we look at it from the critical care standpoint of supporting those injured and ill during a pandemic, whether a man-made or natural disasters that are happening. We saw during this recent pandemic the stress that was put on the healthcare system. We saw that in India. We saw that throughout the region. We saw it even in the United States, where the major hospital systems were overloaded, were flooded with patients, and it put a stress on the entire network. And that goes back to Andrew's point, which is the smaller communities, the smaller health systems that were more vulnerable, that saw the bulk of the patients, and they were the channels that normally would have been able to take patients and send them to larger metropolitan hospitals were not there. And so it relied a lot on the smaller hospitals, the regional hospitals and health centers, to be able to stand alone, to be able to provide care for those patients. And where we saw is those systems just weren't adequate. They were just not trained. They didn't have the equipment or the supplies, the medications. And so it really then put a lot of patients at risk. And so, I guess one of the first points that I would make is the investment in training, the investment in medical education, not going to medical school, not those types of things, but basic fundamental, we provide training or provide training. It's fundamental training within the first 24 hours of an illness or an injury, of how to stabilize patients, how to make sure that they're safe, they're secure before they could be transported up to a larger hospital. There was so many under-trained and under-resourced areas that really put a lot of patients at risk. I think that if we invested in training, or if training was a priority, and not to wait till you had a pandemic to begin training, this is something that should be ongoing. It should be part of a routine, part of a budgeted item every year, is to train those who maybe aren't typically on the front line, that are maybe secondary support people. Have them trained, have them ready just in case there is a disaster, there is a need for them to be able to step up. Secondly, I think that we need to be able to, within the region, is to look at all resources, human and physical resources, as valuable. There are trained people, there are people that are eager to be able to help. And I think when a pandemic or any kind of emergency or disaster, I think we have to be open to accepting all of them, to say, you know, we're a welcoming community. We have to accept everyone here, to be able to support, to be able to help. You know, every voice is valuable. We want them to be a part of this. So I think it's important to accept people who want to help, who are willing to help, whether they have the specific training, but they can be trained, but sometimes you need people who are there, who can assist in any way they can. And then third really is to echo the point that Andrew made, is the collaboration, the partnerships. It's so valuable. I mean, we found great partnership with Direct Relief, that we could use some of our connections and relationships around the world to help fill in some of the gaps that were lacking in some of the organizations. Not one organization is capable of doing this. This is too massive. So it takes a community, it takes a village to really support all the efforts that are needed. And again, you don't know where there's going to come from, you don't know what's needed, but you just have to kind of put your hat into the ring and say, hey, we're here to help. We don't know how we can help, but we're here and we're willing to help. And I think that those partnerships will continue to be valuable. And I don't think we have to wait till there's a disaster. I think we can begin forming these relationships and have them ready, so when there is a need, we can immediately take action and move forward.
Thank you, Mark, for those wonderful points. You, of course, reiterated collaboration and partnerships. You reiterated the need for upfront budget preparedness on a periodic basis. So we'll come back to this actually. Let me now come to Abhinash Mohanty. He's a program lead, Risks and Adaptation, Council on Energy, Environment and Water in India. Avinash, over to you.
Thank you, Gopal. And I'll first of all, thank you, CII, for organizing this timely conversation, and many congratulations for a wonderful summit. What I would like to highlight is that this pandemic taught us something even bigger than what we managed risk. So 2020 and 2021 were actually the years of tail end risk. Risk which have low probability but can be catastrophic, like a once in a century pandemic or the cyclones. So when the cyclones or these extreme climate events were coupled with pandemic, that worsened scenario. In 2020, we observed cyclones across the coastline of India. In 2021, in a span of like 7 days gap, we witnessed cyclones across eastern and western coast. So this compounded the impacts, and we were actually not prepared for handling multiple impacts of tail end risk. And that's what brings me to Mark's what Mark just highlighted, that we need to create that cadre of resources or people within the communities who can actually tackle some of this compounding impacts. And we were clueless, we couldn't do it. The second thing what this pandemic taught us was it calls for an honest conversation and meaningful actions. We can't just be stating, and we can't just keep the purview of managing disasters at the margins. We need to mainstream them, and mainstreaming them requires having meaningful conversations and regional cooperations. I'm sure a lot of regional cooperation across Indo-Pacific has already happened, because we actually cite the most vulnerable countries across the globe. And at the same time, the third lesson that we need to that I need to highlight, and what provides, is identifying risk, which is first and foremost. As Mr. Kishore just highlighted, that we have been looking at risk from a very siloed approach. It might be a cyclone, it might be a flood, it might be some sort of technological hazard which is coming our way. We never look at the coupling impact of some of this risk, and that is where our identification of risk is more important. And this is where we should not be having the siloed conversation of climate scientists trying to predict a scenario where climate extremes are going to come in, or a bunch of health professionals trying to pull in the plug for a more pandemic-like scenario. What does it happen when both of them sit down and their models give out the outputs? Once you identify the risk, again, the risk should not be identified at a long term. Until now, at least in the climate domain, we have been looking at a 2050, 2100 scenario, which we need to look at from a 5-year and a 10-year time scale. And this is what is more important, is identifying risk at a very high granular resolution, which can actually provide an impetus to the compounding impacts of risk. So these are kind of 3 lessons that I like to highlight.
Thank you, Avinash. You raised this issue of multiple risks simultaneously being faced by all of us. Climate change, pandemic. You gave example. We'll again come back to this. Let me now come to Ms. Nisha Biswal, President, U.S.-India Business Council, Senior Vice President, International Strategy and Global Initiatives in South Asia, U.S. Chamber of Commerce. Nisha, over to you, please.
Well, thank you so much, Krish. And certainly we've heard, a lot of really good points from across the board here. Just drawing from what we've seen under the pandemic, I would just say we're moving into a new kind of disaster. And I think Kamal talked about, a systems approach. National governments and subnational governments have all developed very strong response capabilities for specific kinds of disasters, which are localized. If you have a localized event, like an earthquake or a fire or a building collapse or what have you, then there are systems in place that know how to respond to that. There is a command structure in place that knows how to respond to that. When you have a mass scale event that affects multiple geographies, multiple nations, it's a much more complex undertaking. And we have not developed the kind of planning and preparedness and response capabilities that allow us to look at not only a national, but a global event, right? And so here, I think what needs to be thought about is, what are the responsibilities at the subnational, national, and perhaps international or multinational level? But then also, how do you really develop a new kind of public-private partnership? We saw that, for example, in the response to the most current COVID surge in India, that there was a massive international outpouring, not only from governments, but frankly, scaling beyond the government response was the private sector response. In the United States, the private sector both preceded the US government and outperformed in terms of the amount of assistance mobilized, what was mobilized through public channels. And yet we don't have really systemic ways in channeling this. We were inventing it on the fly. So we need to think about what does the future of disaster resilience and response look like? And how do we create ways that go beyond the traditional channels? You have military HADR exercises, you have civilian agency exercises, you have exercises, that are undertaken at the national and subnational level. But how do you plan for an event like what we are seeing unfolding in the pandemic? How do you plan for bringing in and coordinating with the private sector, the NGO sector, so that you don't have kind of the fog of war effect of a lot of well-intentioned and capable organizations and individuals, and yet not a clear coordination mechanism, not a clear mapping mechanism of figuring out what assets are where, and where you have a gap and where you have a surplus, and trying to match it. I think the Indian government did an admirable job in the midst of a crisis of trying to manage all of that. But you're seeing that this crisis is far from over. And in fact, in South Asia, Southeast Asia, new surges are manifesting in Latin America. And yet we have not developed the international or national systems to really help us manage this and to help us respond to this. So I think it's time for a really a new paradigm in disaster resilience and response that brings all of these different capabilities to bear, and to develop the kind of policies and the kind of planning mechanisms that allow us to anticipate, to pre-position, and to call forward assets that might be needed in a situation like this. And what we're finding is that, you know, from the corporate side, there's just enormous both expertise and capability, but also intention of trying to help and support. And oftentimes what gets in the way is the lack of appropriate channels to be able to focus those resources effectively.
Thank you.
I could go on, but I figured we could get into a more active.
Right. So thank you, Nisha. Very important points about working together, public-private partnerships, NGO sector, even at the national level. You know, the coordination is sometimes missing, and across nations. You know, for example, the pandemic is still continuing, and I read in the newspaper that you know, just like India faced oxygen shortages, Italy faced at the beginning of the crisis oxygen shortages. Now Indonesia is facing oxygen shortages, and so you know, we have to figure out how you know, in one place you know, we learned something that it's being propagated to all the regions very quickly. How we can bring together all the different players, you know, public, private, NGO sector together to work at this. So before I come to solutioning, you know, I just want to go around and you know, get your view on you know, what are you know, the different kinds of global disasters or disasters that you know, of this kind, the pandemic kind, that we would face over the next 10 years, especially in this region. And the reason for me to ask this question is that you know, we have accelerated the adoption of digital, and I'm suddenly seeing lot more incidents of issues related to cybersecurity, cybercrime, you know, the ransomware attacks that we are seeing, which is again global in nature. So we are seeing now new types of disasters that are striking, which again require global responses. So I want to, you know, just go around and get your views on what are the potential disasters that we need to prepare. Are the responses similar? Do we need to create specific capabilities? So in the case of cyber, for example, you know, the resources are very low in many parts of the world, and again, it's cross-border also, and here there could be non-state actors, etc. So this time I'm going to go in the reverse order. Nisha, you start first. So the question is, what are the type of disasters do you expect or do you think the world will face over the next 10 years? And you know, any thoughts on are the capabilities similar? dissimilar, anything unique that we need to think about when we face these things? Nisha?
Well, the vast majority of disasters in the Indo-Pacific region are climate and weather related events. As we look at the effects of climate change, that trend is only going to intensify. And so you're likely to see much more extreme weather events, whether it is, cyclones or droughts, glacial melts and flooding caused by that. And so that is, I think, going to continue to be the preponderance of disaster events in the Indo-Pacific. Yet, I think you also are going to have the more complex emergencies, the man-made emergencies that could be conflict related, as you have a migration induced by some of the impacts of climate change. You have, therefore, migration events. You have, you mentioned kind of cyber and, malware type events that could affect critical infrastructure that could then have a humanitarian impact. Some of these are predominantly in the sphere of governments to respond to, and some of these require much more cooperation with industry to try to address. Some of these are more localized in terms of where the action needs to be, and some of these are more wide scale in terms of where the action needs to be. But I think the key thing here is resilience and redundancy in systems capabilities that can really help to build response capacity, right? And that means, across the board. And certainly, Kamal at NDMA can speak to the ways in which India has, for example, really invested in disaster response, disaster management capabilities at the national and subnational. And now the question is, how do you make sure that you're bringing community, but also, the nonprofit and the corporate sector into your thinking and planning as you look at the systems approach? How are you doing the asset mapping of warehouses and facilities? How are you doing the talent mapping of capabilities that can be drawn upon in a mass event? How are you looking at kind of building the redundancies and into your systems, so that if you have a failure of the grid, or if you have a failure of a particular platform, that you have the redundancies built in. So I do think that as we go into the future, there are likely to be more rather than less events that require disaster response. And so the question is, how do we really go about it in a much more methodical way to plan for these events and to build in the contingencies? As someone who spent most of my career in government, I can say it's a lot easier to get funding to respond to an event that has occurred than to get funding to plan for an event that has not occurred. And that's why we are continually coming up short in being able to have an effective and ready response. We underfund the planning and overfund the response.
Nisha, you froze for about 20 seconds. Have you completed?
I did, and I apologize. Go ahead.
Okay. Abhinash, to you, the same question. Over the next 10 years, what disasters could impact this region, and any thoughts on any response that is unique to a particular type of disaster, and the categories of disasters that we would be faced with? Avinash.
Right. Thanks. Nisha has, very broadly outlaid that climate and weather related events are going to be topping the list. But before we move into the climate and weather related events, one of the other risks that this region might face is the NATIC, or the natural hazards triggering technological disasters. And this is what is of a concern now, and it is growing a lot of attention, and in a short-term time span of 5 and 10 years, we are going to see much of NATIC disasters. Since my team and our work at the council is primarily involved in identifying risk, and we are developing a first of its kind climate risk atlas for a developing country, let me break down the region in terms of the hotspots. So first and foremost is the south or the southeast of the Indo-Pacific region is more exposed and prone to floods as well as to recurring drought events. And this is where majority of your poverty, hunger, and undernourishment are been coupled with, and this is going to create that kind of impact. The second is around the region of Pacific Ring of Fire that we call it as, and where our transport, our ICT infrastructures, and the most vulnerable populations who try to get into their livelihoods are going to be affected by typhoons, cyclones, and tectonic hazards like earthquakes. Then the third is the Pacific small island developing states. And this has been a concern where we witness a lot of critical infrastructures, populations been exposed, and there have been like a lot of internal as well as external displacement also occurs, and massive loss and damages have been witnessed. Across compounding impacts, it's not just one kind of impact that they face. It might be sea level rise coupled with storm surge, all of those compounding impacts and multiple threats which have been threat. So we need to clearly the region is going to witness a lot more of these events. Now the question is, how do we address, and coming to your second part of the question, how do we address this and what exactly has to be done? So first and foremost is let's identify the risk first and get the best practices, because I'm sure India is one of the front runner when the thought leadership comes into the disaster management. So a lot of lessons, not just from India, but across the region can be brought in. And India's thought leadership led organization, the Coalition for Disaster Resilient Infrastructure, which is 21st century kind of organization, which has been set up by India, and it has got 22 plus member nations now. So CDRI like organizations can actually take in that leapfrogging, and they can bring in identifying the risk for the region, and simultaneously bring in the best practices, which can trigger the system innovations, what Mr. Kishore as well as Nisha have just highlighted. So it's first you identify the risk, then you enact onto it, and then you implement localized solutions, not to forget. So I will categorize it in this spectrum of the optics that I just said. Yeah.
Thank you, Abhinash. And again, you were also highlighting, weather-related, climate-related, natural disasters, not yet focused on man-made or pandemic-related risks. And the reason why I'm coming back to this point is that, if there is a slow-burning problem, you have a tendency to postpone, right? And there is also a challenge that we still have many people who do not believe that this is actually a disaster. This is a natural phenomenon, maybe occurring over a 200-year period or 300-year period. So these are natural cycles, etc. So I won't get into more discussion, but I would like to put that on the table, because sometimes we don't act unless and until it is a emergency, and that's why I was highlighting in the pandemic or cyber security events and things like that. So let me come to Mark. Mark, the same question to you. What what kind of disasters could impact this region over the next 10, 20 years? Are we ready for it? Are we prepared for this?
So again, I completely agree that I think the region has to be very concerned, actually the entire world, about climate change and these events that we see coming, and we need to respond to them. But I think really from we still are going to face future virus, future pandemics, infectious threats. It's just a matter of when it's going to happen. There's, the medical community still is being very cautious of future pandemics, future events. And again, I think that my fingers are crossed that we'll get through this and it'll all come out okay. What I don't want to happen is that we have a very short memory, that we just forget about it and say, okay, whew, we passed, we're done with that. We can move on and get back to normal. I think we have to be diligent, and we have to prepare for the next virus, the next global pandemic, and do the things that are necessary, do the hard work, do the do the efforts that building infrastructure and training and preparing for those sorts of things that we had talked about earlier. So I still see the threat of a pandemic and infectious disease as still another major threat that we have to be ready for. And it's something that we don't see coming. We see climate change, and it's easy to kind of prepare for or deny it. Pandemics they just kind of happen, and then we immediately have to act. So I think it's better to be to prepare and to be ready than to be caught off guard. The other threat that I see is, and this has been happening for a number of years, over the next 10 years, there will be a global shortage of healthcare professionals, somewhere between 18 to 20 million healthcare professionals worldwide, according to the WHO. And then in the Indo-Pacific region, there is going to be more than 2 million healthcare professionals shortage. And again, that's a tremendous amount of capacity that is needed to care for people who are ill and injured as a result of these disasters, whether man-made or natural, that need to be, we need to invest in today. We need to take the time and to put the infrastructure there to encourage people to enter the healthcare profession, or to begin to train them, or continue to train them to build that capacity. Because whether we like it or not, we're all going to get sick, we're all going to die. We have to have that capacity to deal with the ill and injured, not only in the region, but also around the world. So I see those two threats as really something that we can begin to train for and work for, that can help to mitigate any downstream threats and risk in the future.
Thank you, Mark. And I still want to come back to my point of slow-moving risks and fast-moving risks. And if I look at slow-moving risks, the incidence of obesity, right? It's facing many nations. Healthcare costs are skyrocketing. You, of course, highlighted the issue of healthcare professionals. The incidence of diabetes in India. Suddenly, India has become the diabetes capital of the world. Aging population, right? Again, who and how we are going to pay for taking care of them, how we are going to take care of the mental illness many older people are now facing, and things like that. And I think these are also, to me, global risks and global pandemics, and to some extent, this pandemic actually highlighted the healthcare issues of older population. They died in larger numbers at the beginning of the pandemic, actually. And if they were healthy, probably we would not have lost so many people. So I want us to recognize this, and I strongly believe that a global cooperation is required. As people live longer, they're going to face more issues of dementia, Alzheimer's, the mental disorders and things like that. Again, the costs are huge. So let me now, and I'm trying to put this on the table so that I want to see whether some of you can think about these slow moving risks, but every country is facing them and the costs are huge. And we don't see them as costs, but they are really, really pretty large. So Andrew, to you, the same question. What are some of the concerns that you have, especially in the Asia Pacific region? Andrew.
You know, I really agree with you about this issue of aging population, the growth of a non-communicable disease burden, which links cancer, diabetes, heart disease, hypertension, things that aren't really seen as disasters. They're seen as endemic problems, but as we see time and again, and you really mentioned the pandemic as the key kind of driver here, that when you have a shock to the system, these are the people that are paying the highest price. We saw comorbidities linked to the COVID-19 infection as the single greatest driver of mortality during the pandemic across all countries. You know, I think this is something that we see in every natural disaster as well. I mean, when a flood happens, the people that have the hardest time getting out of the way are elderly, they're mobility impaired, they're people that already have health conditions that they're managing. This is going to be an intersecting problem of just enormous magnitude as we go forward, as you see societies in some ways succeed at improving the health of people by extending lifespan, medical systems that are increasingly able to, do the job of keeping people alive and relatively healthy very late in life, but where that also then links to these accelerating systems risks that we've all described. You know, I think when we think about climate change here, it's important to be somewhat specific about this, because I think the narrative is very large, and it often, I think, feels like climate change itself veers off into these like endemic things which kind of happen and we all know, but we can't really do anything about. We can't stop hurricanes from happening, et cetera. But really what we're talking about here is a shift in the baseline probability of extreme events. You know, in the Western United States, for instance, right now, we're seeing areas of the world that never should see 120 Fahrenheit temperatures, never seeing this happen over multiple days. India sees this far more frequently than many other places on Earth. We're now seeing the rise of a discussion around things that I never used to hear about: wet bulb temperature, which is the temperature at which it is no longer possible to shed heat from the human body because the humidity is so high in linked to the temperature that you can no longer sweat the temperature off. And this leads to sudden death for people that are unable to seek shelter. This disproportionately affects the poor, who have no access to things like air conditioning or the other kinds of technological solutions that we've devised to make life bearable under extreme conditions. And as you shift the baseline so that the probability of those events, not only their temporal occurrence, but also the probability that the occurrence will be outside of our assumed baseline, so that you start to see temperatures in the 130 Fahrenheit, 140 Fahrenheit range that happen, you know, maybe once every 2 years, this becomes something that we don't actually have a process for managing. And then to your point about the slow burn technological problem, I mean, you have to then kind of back up and think, well, we've kind of built an infrastructure, an urban infrastructure, a critical services infrastructure for a world that may not actually exist anymore, where we have housing and roadways and density of settlement that is designed around a world that we used to think we understood, but where when you reset the baseline for the probability of extreme events, may no longer be fit for purpose. And we see this around the world where, you have roadways that buckle at certain temperatures that we didn't expect, and et cetera, et cetera. I mean, you could even link the probability of zoonotic transfer of virus into this question, and say that we don't have a health system that was built for the kind of probability of extremity that we now may be facing. And we have to kind of back out and really think about the infrastructural requirements for that world. And that's a huge role for private sector, public sector, nonprofits, et cetera, to think in creative, forward-looking ways about that world and not like get scared off by it, actually, because it can seem very scary. The last point I'll just put on the table is that this is a world of increasing displacement. What happens in most of these situations is that, especially in climate extreme weather disasters, is that people have to move. This is also the case for conflict. We see the unresolved problem of the Rohingya. Now in Bangladesh and Myanmar, we still have 800,000 people that we have no serious plan for. Climate causes displacement from the coastline. We now, I think the latest estimates are we're over 75 million displaced people globally. There's a whole system of services that has grown up around just purely support for displaced persons. And as you kind of forecast out the trends that I was just describing that everyone else has already mentioned as well, you'll see more and more of this, people that are displaced and displaced again, and where displacement becomes the normal condition. This, I think we have to really think much more clearly about from a legal point of view, from asylum and refugee law, from the services point of view. Is refugee camp the best way to approach this, or do we really need to think much more seriously about integrated services that are linked into the regular services of the society, and destigmatizing the condition of displacement when so many people are facing it? This, I think, is going to be an increasingly significant disaster throughout the South Asian region, where the Rohingya being the most glaring example of it, but far from the only one.
Thank you, Andrew. And I think you've added a new risk or a new disaster, which is the displacement of people. And I'll come back to this in the context of solutioning. So Kamal, on this round, you go last about what are the risks that you see that we need to think about, prepare ourselves in this region, especially over the next 10, 20 years. Kamal.
Thank you very much. I think it's a very difficult question to answer. My first response to that is that past is no longer a good guide for the future. Expect the unexpected, which is not to say that the elements of what will happen in terms of big disasters in the future, we wouldn't have seen it before, but how they come together would be, it can be really, really something that humanity has never seen. The Indo-Pacific region, for example, El Nino and La Nina, they are major drivers of weather and climate in this region. Just imagine that El Nino begins to happen every 2 years. As a result, countries have 6, 7, 8 years of consecutive drought or consecutive floods. Just imagine that the genesis of cyclone shifts by just a few degrees, the location of genesis, and begin to strike areas that haven't seen cyclones before. There is real probability of that. And then it knocks out the power infrastructure there. The power goes down for a month. The telecom systems go down for a month. Telecom system goes down for a month. All the transactions stop happening. People don't have access to their own cash because the ATM machine's not working. So I think the notion of systemic risk, it is emanating not just from the hazard side, but also how the global system is currently built. We live in an interconnected world. That interconnected world has given us efficiencies, but it has also built in risks that we may not be fully cognizant of. We know how to model a cyclone, calculate the probability of a cyclone. We know how to model an earthquake. we know how to model a landslide, but how these things come together, how do you model the concatenation or interlinking of these disasters, we don't know. So we need to actually do sort of foresight planning for reasonable worst case scenarios across the region. And we must not shy away from writing up or conjuring up reasonable worst case scenarios which do not look pretty, which can be much worse than what we have seen in 2020 and 2021. Just imagine something happens to the Indian Ocean monsoon. Successive years, the patterns change. The impact will be enormous, and it has linkage to human health as well. There is a famous case study of saiga antelopes in Mongolia. A slight increase in the temperature activates certain viruses that have been dormant for decades or centuries, and then they come back again, and you see rapid decline in population of saiga antelopes. So I think it is very difficult to give one particular scenario as to this is what can happen, but the risk that is lurking underneath the global system is probably higher than it has been priced right now. So it is really important that we sort of look at what are the reasonable worst case scenarios, and very difficult to model these things. But it is possible to imagine them and prepare for them. And we can talk a little bit about how we can prepare for them. I think one thing, in the discourse we've had in the last 1 hour, I have heard the word response and preparedness. I think one thing that the pandemic has told us is that prevention is not only better than the cure. In many cases, prevention is the cure. You have to just prevent it. If you don't prevent it, it's too late. Just imagine things we could have done in March last year, which would have, if we had prevented certain things from happening, the kind of miseries the humanity would have been saved. I think it's really important that we talk about prevention again and again. Prevention is long-term. You do not get credits for a disaster that never happened, invisible impacts. But, that is where the public discourse needs to go. That's where we need to, engage with the media, engage with a wider set of people across the society to build a narrative like that. Thank you.
So that's why this session is very important. I hope audience takes note of that actually. So we come to now the solutioning, side, and I want to pose this along two dimensions. I strongly believe that technology is going to be part of the solution. Data is going to be part of the solution, and working together in leveraging emerging technologies, the capabilities that we have. The vaccine development is a clear example of how we can leverage technology to create a solution. And the second is the institutional mechanisms that are necessary in order to both develop as well as roll out the solutions. So I want to now go around and get your views on on the technology side, on the data side, data sharing side, on the preparedness side. Do we have the institutional mechanisms in data collection, collaboration, sharing, etc.? And on the operationalizing the solution, do we have the institutions? Because operationalization has to happen on the ground locally. And this is where Nisha talked about public-private partnership, leveraging the strengths of all the actors in the society to implement the solutions on the ground, etc. So Kamal, I will now go back, starting with you. So on the solutioning side, from the technology perspective, data perspective, as well as on the institutional side, what are the things that we could do? What are your solutions that we need to build in the Asia-Pacific, Indo-Pacific region to address the future disasters? Kamal.
Thank you very much for that question. I'm not a technology expert as such, so but at the principles level and having experienced the impact of technology in it cuts both ways, I can offer three potential solution areas. The first solution area is that I think we have to do a better job of doing the basic no regrets vulnerability reduction. You know, the basics, you know, I mean, there is no it's like, you know, if you live in a flood prone city, you know, if you before the rainy season you have to clean the drains, desilt the drains. Likewise, you know, on the technology front, if we do basic vulnerability reduction of our system, no matter what, we will be prepared for dealing with the uncertainties. The second thing we need to do is we really need to diversify our risks. You know, too much dependency, you know, we have to really begin to assess more accurately or more holistically the costs at which efficiency comes. Efficiency and resilience are often, you know, especially for, you know, tail end risks, efficiency and resilience are sometimes, it appears that they are, you know, competing priorities. You know, in the name of efficiency, we compromise on resilience. So we really need to diversify our risks, not put all our eggs in the same basket. And the third is we need to have an institutional mechanism where we get out of the mode of doing static risk assessments. You know, we are entering an era, I believe that in some ways the humanity has already reached a tipping point. And in that tipping point, a risk assessment done yesterday is no longer relevant today. You know, we have to get into a practice of continually updating the assessment of our risks from various angles. And that really requires an institutional culture which goes outside of our comfort zones, engaging with multiple disciplines, evolving a common language, and having those conversations about risks more frequently. Thank you.
Thank you, Kamal. You know, just to highlight two things from what Kamal said. One is, you know, resilience versus robustness. Resilience is after the fact. You know, how do you recover? Robustness is how do you prepare yourself? You create that institutional mechanism even to prevent a risk from indeed happening. And the second aspect about continuous risk assessment, real-time risk assessment. I think if you are a business today, you know, this is a practice that needs to be institutionalized. You can't wait for the risk to happen, or you can't do periodic assessment. It has to be day in and day out, real-time monitoring of risk and things like that. And it's possible today with the use of technology for doing real-time assessment. So same question, Andrew, you know, on the technology side, what are the solutions? On the institutional side, what are the solutions possible? Andrew.
Sure. You know, just a quick word on the technology front. You know, I think we sort of have an interesting moment in front of us, in the sense that we've never had more data to do the kind of risk assessment and modeling that you know, I think everyone has called attention to thus far. But often it's I mean, almost always, it's data that's produced by private actors and is held in private hands. And the models for deploying large-scale private data towards collaborative public good solutions are few and far between, actually. I'll cite one example. During the pandemic, one of the things we found was incredibly useful was that you know, people throughout the world are walking around with mobile phones that produce location signal. And when you scale that up, you get something like a real-time map of the dynamics of people in day-to-day life. So when the time came to do things like impose lockdowns or social distancing restrictions, and to have at-scale global health policy to mitigate the pandemic, we actually had a signal available to monitor whether that was working and to adjust policy as it happened in a way that just really did not exist before. I mean, I've been involved in a number of these. Probably the first pandemic I was involved in was the H1N1 pandemic back in 2008, and we didn't have anything like this. And so the question of being able to do sort of at scale real-time modeling of population dynamics of relevance to disease and health policy was just not on the table. We live in a different world, but that created lots of risks. So it created the risk of privacy disclosure, of the use of that signal for purposes other than public health, for things like state surveillance and law enforcement, and things that went way outside of the boundaries of the immediate concern of the pandemic response. And we had to really kind of invent on the fly a whole set of collaborative measures with private companies, with researchers, with the government, in order to be able to figure out how do we make this safe to use, and then also intelligible within the context of our response environment. And that is going to be, I think, really of increasing significance as we go forward, as companies like Facebook and Google, Amazon get larger. You see this, more ubiquity of these digital signals, but so there's more ability to then do that kind of real-time assessment, but you have to really think through the policy environment and the legal environment to make this not itself a kind of toxic environment for data circulation. I think one of the key things we've seen, and just the second point is just that, with the vaccination effort, the science in some ways was the easy part, which is a little weird to say because it was breakthrough science. But the hard part, as we've seen, is the distribution. It's getting things to where they need to go. So obviously
Andrew,
we need more. Yeah, go
Andrew,
ahead.
sorry to interrupt. We will run out of time. So
Sure.
Yeah.
I'll just cite that, and folks can pick.
No, Andrew, you're muted.
Sure. No, just that you need more attention to distribution,
Okay.
and make sure that we solve these distribution problems.
Thank you. Mark, same question to you very briefly, because we're starting to run out of time. Yeah.
No, I agree. I'm not a data expert, so I won't even attempt to make a comment. But I think I go back to really the basic, the perspective where I come from is really health security and healthcare capacity. And I think we really need to focus on just a few simple things. And as we've seen, some of the gaps in the healthcare system was we need to stage and have supplies ready to go and have capacity ready, have those staged around the world so they can be accessed very quickly. I think we need to train more people. I think that's the basics. I think that's an ongoing, continuing process. Train more healthcare professionals. That'll help not for pandemics, but also just in general, the health, as you referred to about the systemic problems we have in our culture. Create maybe rapid response teams that can immediately go and assess, create, do a, kind of take a quick snapshot of what's going on and report back. And also, I think there needs to be better international cooperation. Treaties, organizations that says, okay, we don't need to go through the customs and all the different, hoops you've got to jump through to get products in. I know, Andrew, your team was constantly having products sitting at airports waiting to get customs and approvals. We need to break those down. Those need to just, go away. And we do from the same point from volunteers. We need to be able to get volunteers there quickly. So just a way to kind of, smooth that transition. I do want to point out one organization in the region that I think is maybe doing something unique. It's the Indo-Pacific Center for Health Security, based in Australia, that seems to be wanting to do a lot of the things and is doing a lot of things to help the region become better equipped and better able to handle its healthcare security. So I'm going to kind of do a shout out to them to just a quick research on what they do. They seem to be maybe someone who is doing some really good work.
Thank you, Mark, for those comments. So Abhinash, to you.
Thanks. I mean, whatever has been highlighted are quite pertinent and quite timely. I think what lacks in the current framework is we always have a piecemeal kind of approach, and we need to integrate them. So what I'm going to do from a public policy point of view is, and we research quite a lot about this, I'm going to propose a 6I framework, how we can build more resilient kind of Indo-Pacific region, which starts with the first I is of identification of risk, as I have been highlighting right from the inception of this discussion. And once you identify the risk, you need to understand the inclusiveness. What Nisha just highlighted was creating that pool of public-private partnership beyond the realm of government spectrum and government support. You need to identify those stakeholders which are inclusive, and not just the stakeholder from the demand side or from the supply side, but from the targeted beneficiary side, which includes your gender, your vulnerable age groups, and others. So it needs to be inclusive. Then you need innovations. Innovation should be categorized as two innovations: one on the technological forefront, where you need technology to tackle some of the still interests that we have been discussing. And the other one is on the system side. We really need system innovations in terms of creating that robustness for our public policies, for our governance systems, for our institutional frameworks. Those have been existing, because those siloed approach are not going to happen and work anymore. And then you need, once you identify this and create those innovations, you actually need investment. Because without investment, and this investment is not just public investment or private investment, this needs a regional investment as well, creating some sort of a global risk pool or a regional risk pool, which can identify and be should have a razor sharp focus, I would say, to tackle at least some of this compounding impact for the region. And then you have interventions. You should start picking up what Mark just highlighted about the Indo-Pacific Center for Health Security. They have been trying to create that empirical evidence by piloting some of these efforts. So clearly you need to build that resilience, create that empirical evidence, and take forward that in terms of integrating it not only at a regional level, but at a national, sub-national, and further below. So this is what I would say is the 6I framework, which can connect all of our DIRTs, and we can have a more resilient Indo-Pacific region. Because clearly what we are discussing is limiting our limits into 1.5 or 2 degrees, but whatever effects we have seen is a 0.6 degree rise. So we need to step up our action at a most accelerating level. Thanks.
Thank you, Abhinash. And Nisha, you have the last word before I conclude. So from your perspective, how do we look at solutioning?
Well, I first of all just want to acknowledge all of the great points that have been made, and I don't want to repeat what's already been said. So let me focus in a slightly different direction, because I agree with everything that's been said so far. Look, we know that as the challenges and the risks that we face evolve, so too will our ability, our technology, and our capabilities to respond. I have great faith in the research community. I have great faith in the corporate community and in the ability of governments to respond. But we do need to address some fundamental challenges to human understanding and human behavior at a large scale. The ability to support investment in resilience, preparedness, and planning. It requires a real focus in civic education, in building understanding at a mass level. In responding to the pandemic, the major challenges, I think Andrew might have referred to this earlier, the major challenges have not been in trying to meet the need the skills, the innovation required to beat the pandemic. The major challenges, in my opinion, have been in trying to adapt human behavior to the need of the hour, to be able to ensure that we have the understanding at the governmental level and at the population level of what people need to do to be safe, what people need to do to create safe communities, and to get that collective action. And to me, that is a failing in our ability to, as a society, to teach the right civic mindsets and understanding for that kind of response. And I would hope that as we look to the future, that we can be doing more investing in that. Here at the US Chamber, I will say that that is a major focus for the Chamber. Both in terms of disaster resilience and preparedness, which the Chamber has long been active in, but also in investing in civic education here in the United States, so that we have that understanding at a societal level to be able to meet the challenges that are for sure going to be facing us as we face the future.
Thank you, Nisha. Very important point in terms of education, awareness, and I would also add education and awareness of leadership also, because we need the leadership to also look at the science behind it, look at the experts, and work with the experts to understand what solutions need to be deployed, etc. We have actually exceeded time, but I thought this was a very, very interesting discussion, very important topic. And since this was the last part of the 3-day event, we could exceed a little bit. We have exceeded about 3 minutes. I will not try and summarize. The whole thing is recorded and will be available for people to listen and get their notes. I think a lot of wonderful points have come in terms of what lessons we have learned, the type of risk that we can anticipate or we can see, and to some extent in terms of solutioning, we have attempted to come up with some ideas and things like that. So thank you all very much on behalf of all the participants, Nisha Biswal, Kamal Kishore, Andrew Schroeder, Mark Lenhart, Abhinash Mohandi. Thank you all very much, and over to you to CII to conclude. Thank you very much.
Thank you, Mr. Gopalakrishnan, for your sharing this session. I think it has been an excellent, very interesting session. Thank you very much for it. And with that, ladies and gentlemen, we come to a close of the 3-day Indo-Pacific Summit organized by the Economic Diplomacy Division of the MEA and the Confederation of Indian Industry. Thank you very much for joining us. Have a good evening. Thank you.
Thank you.